have to dip out at any point, we will distribute these slides and the recording afterwards. Okay, now I'd like to hand over to our first speaker, Jeff Barnes, our Deputy Director for Public Health. Jeff?
Hello, good afternoon. So Royce, you'll be moving the slides on, will you?
Yes.
Yeah. Okay, thank you. So yeah, I'm just going to talk for a few minutes about the kind of epidemiology that we've experienced in recent times, and what the current situation is in relation to COVID in North East Links, and talk about some of the programmes that we have in place to support the prevention and management of COVID going forward, and just give an overview of the future as we see it over the next few weeks and months, and how it relates to the business sector within our area. So the first slide that you can see there is the chart we often use that gives a display of the epidemiology that we've seen over the last year or so in terms of cases of COVID in our area. So the bit to the left is the first wave. Essentially, it looks very low in terms of cases. That's really because we didn't have the testing available at the time, and the testing as it developed over last summer meant that more and more cases were being identified, so that by the time we get to the second wave, which is the hilly mountainy period here, that's a real good analysis of the actual numbers of cases that were being that were occurring in the country. So the second wave came in two areas. So in the first part, in the autumn, where we were hit very hard in North East Links, the worst we've had in terms of cases. We were having up to around an average of 25,000 cases a day across the country at that time. Things improved in the lead up to Christmas, and then deteriorated again in and around Christmas and the January time, to the extent that nationally at one point we were seeing on average around 55,000 cases per day. You can see from there how the impact of the third national lockdown has dramatically reduced the number of daily cases, and as of last week we were seeing on average just over 3,000 cases per day across the country, and that will be lower again this week. So a much more positive picture now nationally. Moving on. This is the kind of map of the country showing infection rates as of the previous week across the whole of the UK. So we are obviously just to the south of the Humber. We are in that kind of dark green colour, suggesting a rate between 50 and 99 per 100,000 per week. Most of the UK now is in the lower band, the 10 to 49. So our rate, as indeed the rate across Lincolnshire and the Yorkshire and Humber, is above average, though a lot less than it was at its peak. We had an infection rate of over 600. This week it's fallen to around about the 60 to 70 mark, and will fall again over the coming week, and I expect it to drop below 50 within the next week or so. So certainly a much more positive picture, but as I say, the region that we are in continues to face amongst the highest rates of COVID in the country. Moving on. So that's the exact figure for the previous week in terms of our infection rate. So 67.7 infection rate for all ages. That's 67.7 per 100,000. Our population is at 160,000, down around 20% from the previous week. We are, of course, very focused on infection rates in the over 60s, because that is where we get the hospitalisations and sadly the deaths from time to time. And that has come down dramatically. Again, that at one time was around the 600 mark. Today, or last week, it is down to around 16 per 100,000. That is very much associated with the success of the vaccination programme, with over 95% of the over 60s now vaccinated. The results of that are really being borne out in terms of much reduced infections in that age group. Similarly, the last line there, the positivity rate, that's the percentage of people testing positive out of all tests that are carried out. So that's around 3% now. Just a few weeks ago, it was around 10%, and that's a good indicator, really, that things are improving, and will continue to improve for the foreseeable future. Moving on. This rather detailed little chart here shows infection rates day by day, essentially, for various age groups, and the positive picture overall is that most of them, since March the 11th, where that starts on this chart, shows a falling numbers over that time scale. So that's the rate per 100,000. So taking all ages, it has dropped from 152 on March the 11th down to 68, as shown here at the start of April. And as I say, the older age groups are the ones we're particularly focused on. The one area which I think has been going in the wrong direction is the 11 to 16 year age group. How much of that is real is perhaps questionable, in that of course you may be aware there has been a lot more testing going on in that age group since the school testing programme was introduced. So previously, whereas some of those cases may not have been picked up because they were either very low symptoms or asymptomatic, now they are being picked up much more. So that may be a bit of an artifact in terms of whether the infection rate really has gone up in that age group, but pretty well all other age groups we've seen dramatic downturns. Next one. And again, I won't dwell any more on that. That shows the line of trend, really, again pointing very much downwards, which is what we would want to see since the start of March. So indicative of an improving situation. Moving on. By ward, I mean, this does fluctuate very much within the borough, the actual number of cases per ward, albeit we do tend to see certain wards being most hard hit, essentially. So the wards in the central part of the borough, things like Yarborough and Freshney and Park Ward and Heneage Ward, do tend to be the ones that we get the highest rates. And for want of a better definition, these are the wards, I think, where you do get a lot of working age population and a lot of people perhaps working in the low wage economy, where people may find it difficult to self-isolate, and that's been a particular focus in North East Links to address those factors in our COVID prevention plan. But it does fluctuate week to week as case numbers vary and outbreaks occur, etc. Next one. So in terms of the other impacts, so I think we now have around 5 patients with COVID-19 in the Diana, Princess of Wales Hospital. That is down from a peak of 90 in December. So a dramatically improved picture there. We still have issues in a number of care homes, albeit not on anything like on the scale of the early part of this year and the end of last year. During the latter part of last year, between October and November and December, we had a lot of deaths associated with COVID in the borough, over 200 excess deaths overall, and since the start of the pandemic, 348 deaths have been registered with COVID-19, identified as a cause of death within the borough. The position as regards deaths is much improved since the start of the year, and I think last week there was just 2 deaths registered with COVID, and that is a trend that is likely to continue. And overall, in terms of since January, excess deaths in our area, we've had excess deaths in only 4 out of the last 11 weeks, and that basically means that overall deaths now are lower than expected, whereas, say, in the period between October and December, they were running way above the expected levels. So again, a generally improved picture there as well. Next. So what are the factors that we see? Well, overall, households are probably the single biggest exposure to COVID, and where the majority of people still probably pick up COVID, as in somebody within the household tests positive, and then other people within the household also test positive. Sometimes the whole household will develop COVID. We have many examples of whole households testing positive. The vaccination programme, as previously stated, is proving to be extremely successful in reducing illness and deaths in the over 60s, where we've had exceptionally high uptake in vaccinations. So that's been really good news. Workplaces are after households probably the second most common cause of exposure to COVID, and we do continue to see outbreaks in particularly the high risks working environments. So within North East Links, the most obvious area of large outbreaks has been in some of the food factories, where we've had outbreaks exceeding 70-80 people in the last few months. We have seen outbreaks in shops as well, and particularly in the large supermarkets. We've seen outbreaks in schools, and again, probably not resulting in major impacts in terms of hospitalizations, but certainly causing quite a bit of disruption within the school setting. In terms of what are the underlying causes that we see, well, certainly we hear and see a lot of evidence of community fatigue with the measures. Certainly this has gone on a long time now. This third national lockdown in particular has gone on for several months and has been in a difficult time of the year as well. So people have been quite weary, I think. Also perhaps some complacency on the back of the success of the vaccination, people thinking that it's over maybe, and not necessarily following the guidance. When we do get outbreaks, we often find that it's not so much on the factory floor or the shop floor where cases are emerging, but in the kind of socialising time or the downtime, the travel to work time when car sharing, or in locker rooms or smoking shelters or canteens, etc., where COVID tends to spread most likely, and that's where people may be less likely to wear face coverings or other PPE. And that seems to be a lot of the time where the virus is spreading. And of course, a proportion of people do not follow the self-isolation guidance. They continue to go to work when they are unwell. They don't get tested. They don't isolate when they've been identified as contacts. This is particularly prevalent in low-income areas, in the 0 hours sort of arrangements, the jobs where people have to go to work or they don't get paid sector, and also within the black economy, I guess, as well. So a number of measures are being taken to try and address that, and more on that in a moment. Next. So you may be aware of the testing programme has had a lot of publicity nationally in recent weeks. The UK government certainly very keen on encouraging the widespread uptake of lateral flow tests. These are rapid tests that can be done on people who have not experienced any symptoms. There are a number of different aspects to that, which I'll try and summarise here. So there are national programmes where people can register via gov.uk website to access large numbers of these tests. And so these arrangements have been rolled out to the health and care sector and the education sector. Businesses with greater than 10 employees have been given access to on-site testing as well, and that's been extended. So if you have more than 10 employees, you might wish to register for that. You have until 11:59 p.m. on Monday to do that, and the website detail is provided there. Alternatively, businesses with more than 10 employees can sign up to a collect model for workplace for home testing as well, that can be registered locally. There's going to be a pharmacy collect service that will be established at the end of April as well, so whereby people can access the testing at the local pharmacy. Within the local authority, we've established a community assisted testing programme. That was initially established for what are defined as key workers, and also members of households or children or childcare bubbles within schools, etc. When we've established 3 sites across the borough for people to access this community assisted testing, whereby they attend the site and have a test administered there, and they can get the result there and then as well. So those sites are at Grimsby Town Hall and the Knoll and Immingham Library. And there's now being established a community collect home testing model, which might be relevant to some of the businesses that are online today, particularly as it's aimed at businesses with less than 10 employees. And this is an arrangement whereby people can collect test kits, either individually or the businesses as a whole, at these testing sites. And there will be a program of training is being developed to support people. It's not difficult. Many of you will have already carried out these tests on yourself, but we do advise following that people do access a training package or an online training package to supervise this lateral flow tests as well. Next one. So as I say, one of the key variables really in terms of maintaining our control of COVID, our numbers, as I say, are dramatically lower than they were, and we want to keep them dramatically lower than they were. And support for self-isolation is considered really, really important for that. So within the local authority, we have a test, trace and isolate support team, and anyone who is required to self-isolate will be contacted by that team and offered a range of support during the 10-day self-isolation. So that might involve assistance with food and shopping, financial assistance, assistance identifying, accessing medicines and prescriptions, any health and well-being advice needed, and similarly animal welfare issues, carers and volunteering. All of those we can provide support to people required to self-isolate. There is also the self-isolation payments that are administered locally for people on relatively low incomes who are required to self-isolate, who can apply for up to £500 self-isolation support payments, and there's the application process for that is on the local authority website. Next. So I've mentioned vaccination a few times. This is absolutely key to bringing this to an end in as short a time as possible. And to date, the vaccination programme has been run for largely the over 50 population and healthcare workers and social care workers. It's the biggest vaccination programme ever run in the UK and has been a massive logistical exercise to establish. So far, it has achieved remarkable successes both locally and nationally. Currently, over 75,000 vaccinations have been delivered within to North East Links residents. That's approaching half the population of North East Links will have now accessed a vaccination, and 95% of people over the age of 65 have accessed at least the first dose of the vaccination, and similarly for care home residents as well, and for the clinically extremely vulnerable. As I'm sure you're aware, the way it's being delivered is we're going down the age groups, so that currently I think pretty well everybody over the age of 50 should now have been invited for at least the first dose, and from either the end of April or May time we'll be moving on to the 40 pluses, and then onto the 30 pluses, and then onto the 20 pluses, with the aim that by the summer, the middle of the summer, everyone will have been offered a vaccination, and hopefully in excess of 90% will have responded, will have accessed the vaccination. We are taking a very vigorous approach to this, in that anybody who doesn't respond, or we are following up through door knocking to A, find out why they haven't taken up the vaccination, and B, maybe to support them or persuade them that this is something that is in their interests to do. As I say, it is in all our interests across the borough that we have the highest uptake of vaccination, because that will help us to prevent further waves of COVID and potentially further lockdowns. So any support that can be provided from businesses in terms of vaccination is greatly appreciated. Next. So the roadmap out of lockdown, obviously, again, you may be aware of the 4 tests, and although the various dates are being come up with, the next one being Monday, April the 12th, in terms of releasing lockdown measures. Government are saying it's not the dates, it's the data that will drive whether or not those dates are achieved. And the data that are being looked at are things like the vaccine deployment, uptake information, evidence that to show that the vaccination is working in terms of reducing hospitalisation and death, and so far that certainly is the case. We were looking to see that infection rates do not risk a surge in hospitalisation. So if things started to go in the wrong direction between now and May the 17th or now on June the 21st, then some of those lifting of the lockdowns may be put on hold. And an assessment of the risks associated with so-called variants of concern. They again are the things like the Brazil variant or the South African variant, where it is perceived the vaccination may be less effective if those variants were to take off in any particular locality. Then there might be variation in terms of which areas get lifted out of lockdown. Within North East Links, we have so far managed to avoid any variants of concern within our population, unfortunately. Next. I won't dwell on this in any detail. I think you'll probably get the slides, and this is the various steps out of lockdown. So we've already passed the step 1 in terms of 8th of March and 29th of March, particularly the opening of schools and enabling people to mix in outdoor settings, etc. Obviously, a big one is Monday, and that will be things like the opening of shops and personal care and libraries and indoor leisure, etc., etc. And also some holiday accommodation, self-contained holiday accommodation. The next big date will be May the 17th, where various other restrictions are lifted, so things like indoor hospitality, indoor sport, remaining accommodation, along with more social contact being allowed as well. And the final step 4 due to happen on 21st of June, where the majority of restrictions are currently expected to be lifted, albeit we do have an expectation that some measures will remain in place. For example, measures encouraging social distancing beyond this date are likely to remain in force, I would say. Okay, I think that's the end of my opening bit anyway. I don't know whether we intending, Royce, to open it up for questions at this point? Or?
Yes, yeah, that's okay. So the next section is about the economy and opening up and business rules, restrictions, reopening, and so on, and then some grants stuff at the end. So just to keep that in mind when you're asking questions, if you've got any questions now about public health, about the, COVID across the borough, by all means, pop your hands up or type it out in the chat and I'll put them to Jeff. I'll give you a few minutes just to do that. Also worth saying, just popped up very timely, Stephen Pintus, our Director for Public Health, has joined as well. So he's also on hand to answer any questions you've got. Okay, I've not seen any hands go up. If I've missed anything, somebody shout up.
No, I can't see anything. So.
Okay, I've not seen any questions in the chat. So what I'll do is I will move on, and then if anybody does pop anything in, I will interject if appropriate, or wait till the end of that section. Okay, in that case, again, appropriate timing. Carolina Borgstrom, our Assistant Director for Environment, Economy and Growth, teeth in there, is now going to talk a bit about the reopening stuff. So Carolina, if I can pass on to you. Thank you.
Thank you very much, Royce. So could I have the next slide, please? So I'm going to go through a little bit around the rules that are changing with the reopening, what's staying the same, where there is some changes, and also touch a bit on what we're doing as a local authority to make sure that the space we manage is safe outside shop and in the further open space. So as Jeff already mentioned, there is a big change coming in from the 12th of April, which I'm sure you're all greatly anticipating and prepared of. So we're now opening, now it's preparing for shops to open, close contact services to be allowed to reopen, and also for restaurants and pub to be allowed to serve food and alcohol to customers outside. If you are in any way unsure about which venues and which businesses are included in this step, we would advise you to go to the government website. There is a lot of good information on there and some very clear advice and guidance of exactly what's included in the 12th of April steps and what's having to still wait until the potential of 17th of May or the 21st of June. Next slide, please. So one of the things that's changing this time around in reopening compared to other times is the more strict requirement around QR codes. So some of you would have already last summer downloaded QR codes from the government website, put them up in your premises and started to keep details of your visitors. These requirement this time around is much stricter. So certain businesses must request staff, customers and visitors to take part in the system. So either scanning the QR code or by other means record the details of people that come into their premises. And this includes all the hospitality services, tourism and leisure services, close contact services, community centres and village hall. So if this is a new requirement for you, I would advise you to visit the government website. There is a clear process on there on how to download the QR codes. If people do not wish to use the smartphones to record it, you need to have alternative records in place, including the staff working and the shift times they're working on. And you also need to be able to keep these records for at least 24 days before destroying them. Next slide, please. Then following the 12th of April thing, on the 17th of May, we're then expecting the next stage of the reopening where pubs, restaurants and other hospitality can seat people indoors, and where this time around is going to be a little bit different again to last time it was reopening, with it being expected to be no restrictions on the size of meal for alcoholic drinks and no curfew in place. We're also expecting to see larger groups being able to gather outdoors at that point in time, and also the reopening of hotels, hostels and B&Bs. Next slide, please. So how to make sure that we remain COVID secure is going to be a main focus for people opening. And you will be pleased to know that a lot of the things are exactly the same what was the case during the summer and autumn. So the basic is still there. So if you carried out a risk assessment last time around, that still should be valued. To give it an extra check over to make sure nothing's changed. It's about having cleaning, hand washing, hygiene procedures in place, and also take all reasonable steps to make sure people can keep 2 meter distance in the workplace and with customers as far as possible. There is a lot of sector-specific guidelines online. Some of these will be the same as last summer. Some of them will have changed slightly. So please visit the online gov.uk page. Find the one that's relevant for your sector. There is a lot of guidance on there, pictures, diagrams, exactly what expected in each type of premises to make sure that things are adapted to your specific environment and remain safe. Next slide, please. If you have any questions around this, so first port of call is the .gov website. We also got some extra guidance and support on our website. And in relation to our businesses in North East Lincolnshire, if you have any specific questions or after looking at all these guidance, things still not fully clear for you, please make contact with our trading standards team. They will guide you to a multidisciplinary team, whether it's environmental health, licensing, homicide police, and they meet every other day to discuss any queries or any grey areas in the guidance. And if they can't find an immediate answer, they will make sure they direct you to a place where someone can answer your query, so you are absolutely clear on what is the right way forward for your business, so you can operate in a safe way and within the law. Next slide, please. So our experience during this is the majority of our businesses been incredibly good. They have done the absolute best they can following the guidance. They have found new ways of working and being very, very innovative in merging the new public health requirements and also being able to continue to trade the best they can through this. But there is a few that have struggled a bit more than others, and the common mistakes that we've seen is for people to not consult the government guidance, not using all the information out there, not picking up the phone or sending an email to ask when they're unsure about something. And also we have a few that have assumed that there is no enforcement powers or they wouldn't be used and they can just carry on the way they want to do, whether or not that's the legal requirement or not. So our advice is to check the government guidance for your specific sector and ask. We're always here to help and advise and support, and our aspiration is to be there to support you the best you possibly can to find ways for your business to trade safely within the legislation that's out there. Next slide, please. We also start seeing quite a lot of inquiries now in relation to payment licenses. They're especially relevant for our licensed premises where they can open up to serve drinks if they can, if customer can be seated outside. And knowing not all pubs have beer gardens, we will continue to look favourable on payment licenses wherever we can facilitate space on our payments without affecting the safety of free movement and people passing by. If you need space in the public space on the payment, you need to apply for the payment license. The cost is £100 for the full season, and there is a link on the council website for how that application needs to take place. Next slide, please. So in addition to providing advice for businesses, we also manage a lot of public spaces ourselves. That includes our parks, that includes Cleethorpes Resort, and naturally we have a key role to make sure the safety of public spaces, both to reduce the risk to residents and visitor number, but also create a safe trading environment that other businesses can thrive in. So we have a public space recovery plan, which is designed to mirror the government's roadmap and make sure that we reduce the risk and also that we comply with the legal obligations that government placed on us in relation to space. And that's focusing on 5 main areas. It's about managing visitor numbers, safe pedestrian place, hygiene and cleaning provisions, communication and engagement, and enforcement. And what we're trying to achieve, especially around the resort where we're having to intervene sometimes, is to limit disruption and costly interventions for the time where the need is the highest to reduce that risk of rising infection levels. Next slide, please. So in Cleethorpes Resort, you may have already seen some of this action in progress because social distancing continues to be essential precautions. We are now starting to see growing visitor numbers, which is great to welcome visitors back, but it also means that it's becoming increasingly challenging with space, and especially circulation space and queuing space in the resort. So one of the actions we put in place is that we will continue to close the central promenade during the busy times, at least until the 21st of June during opening timescales, and that will allow us more space in the resort where it is the busiest for people to maintain distance. We also have placed quite a lot of additional bins in the resort, and that is to cater for the residents having to eat their takeaway food and maybe even takeaway drink in the resort during the first stage of the lockdown, and making sure that waste provision is available in the resort to make sure the space is kept clean. We also will retain the extra hygiene precautions in place, such as the cashless parking, hand sanitizer station, and we also have implemented more frequent cleaning of toilets and high frequency touch points in the resort. Our resort safety team is out and available as they always are, and we also have additional COVID assistants that will continue to be present in the space, provide guidance and advice to residents, help out around queuing and pinch points in the resort, and also be able to provide advice and support for businesses around the resort on how to stay safe and how to comply with the legislation. Our overall aim is to achieve good level of compliance with a restriction by effective information, advice and guidance and support. However, we work very closely together with Humberside Police, and we monitor and enforce any non-compliance with COVID legislation, antisocial behaviour or our public space protection order wherever is necessary. Royce, I think that was the end of my part. So I don't know if you want to stop for some questions.
Yes, yeah. So the next bit is about grants. So before we go on to that, has anybody got any questions for Carolina on that side of things? As with before, use the comment section or pop your hand up and we will answer them. Just while we're waiting to see if anyone's got any questions, Steve, is there anything you wanted to add so far?
I was just going to finish off with those key messages, Royce.
Okay, it's fine.
If that's, and Jeff's okay with that, just to echo some of the things that have been said.
Okay, no problem. Can't see any hands up. Just checking the comments. No comments yet. Okay. Well, as I said earlier, we will have a roundup session at the end. So if you've got any comments, any questions, pop them in and we can answer them at the end. So next on my list, I've got David Robinson, our lead investment officer at the council, who's going to talk about some of the grants available. So if we start from there.
Thank you, Royce. Yeah, so as Royce has said, I'm going to talk principally about the Restart grant, the clue being in the name. This is funding that's been made available by national government through local authorities to support businesses to restart the businesses. There are two strands of that grant, one of which I suspect will be more relevant to the bulk of the audience on this webinar, but also the key point is there is a grant that's been up for some time now, which is the Closed Business Grant Scheme, which exists to cover a period of support from the 16th of Feb to the 31st of March. I won't talk in detail about that because it's been around a little while now, but again, all the details of that are on the web link that is part of this presentation. So if you've got any interest in that, certainly visit the website. And go to the next slide. Thank you, Royce. Yeah, so in terms of the generic overview of this scheme, for businesses to qualify for funding, they'll need to be on the ratings list, or the premises that you occupied will need to be on the list. This is a one-off grant. As it is a grant, it's not expected to be paid back, but it will be expected to be represented on your accounts as income. And then obviously if your business does make a profit, there will be a tax implication as part of income. But you need to have a word with your accountants about that one. We are already past the 1st of April, obviously, and I'll give you a little bit of news towards the end of the presentation. with regards to payment runs and how much money has actually already gone out to local businesses through this grant process. It's fair to say that government is asking us to take a bit of a harder look now with regards to this funding and any anti-fraud issues that we need to address as part of the process. As I say, that's probably a bit stronger than it was. But the key point being, and hopefully this applies to many or most of the audience on the webinar, if you're already in the system, if you've already received support, hopefully you will already have received the remittance advice for the payments that went out yesterday. In terms of the key point being that you as a business would need to have been actively trading on the 1st of April to qualify for the funding as well. If we can go to the next slide, please, Royce. So as I said earlier, there are two strands to this grant regime. First one being applicable to non-essential retail premises and businesses. As stated, you need to be on the ratings list system, but in essence, the larger the premises you occupy, the larger the grant support you will receive. So if you're in a premise with a rateable value of up to £15,000, you will receive £2,667. If the premise has a value between £15,000 and £51,000 as a non-essential retail business, you'll receive £4,000. And if your premises has a rateable value of £51,000 or over, you'll receive payment of £6,000. And go to the next slide, please, Royce. Strand 2 covers businesses in hospitality, accommodation and leisure, also personal care and businesses like gyms. In terms of the values, the rateable value sort of bands are the same. But if you're one of those kind of businesses in a premise with a value up to £15,000, you'll receive a grant of £8,000. If the premise is a value between £15,000 and up to £51,000, you'll receive a payment of £12,000. And if the premises you occupy as one of those kind of businesses has a value of £51,000 or over, you'll receive a payment of £18,000. In terms of the amount of money that has gone out, we are planning on 2 payment runs this month. As I've already let out the bag, yesterday was the first of those. Nearly £9 million has left the council to go into the accounts of local businesses. That equates to nearly 1,200 local businesses. The next payment run is due on the 29th of April. If you don't believe you're in the system and you haven't applied for a restart grant, if you can just go to the next slide, Royce, then you need to go to the council website and click on this link, and all of the grant information, the detail on what kind of businesses are eligible, and the application form you should find through this link. The next payment run for the restart grants is planned for the 29th of April. With the best will in the world, I would expect you, if you haven't made an application a week prior to that, then I think we might struggle to get you through. But in essence, hopefully, as I've said, for the bulk of the businesses in the audience, hopefully you received the remittance yesterday and the money is making its way to your account. Have we got the good to go slide, Royce? No.
I think I removed that because I thought it wasn't relevant. Is that right?
No, that's fine. That's fine.
Okay. So that's the end of your section, isn't it, Dave?
It is.
Okay, brilliant. So if anybody's got any questions, pop them in the chat. I'm just going to bring up the next slide, which is the key points for Steve to go over. So do pop your questions in while I try and work out how to change the slide. I can't see any hands going up. Okay, while we're waiting to see if there's any questions, and Steve, did you want to touch on those key messages? Is that all right?
Yeah, thanks, Royce, and thanks to everyone contributing. Thanks, Jeff, for leading this off. I guess I just wanted to, and also thank you for giving up your time. And clearly, there's only a few of you perhaps on the call, but you'll have colleagues and business partners that you can convey this message to, really. Just to echo what Carolina was saying, a huge thank you. I think what's remarkable about the way we've behaved in North East Lincolnshire is by and large we've adhered very, very well to the guidance. What I would say though is we're entering into quite a difficult time, in the sense that we're pushing on the vaccination, but that changes people's, if you like, their attitude towards everything, and also in the spirit of everything easing in terms of restrictions, people might get a little bit more lax in terms of the guidance. So it's a difficult thing we have to deal with, and we're really seeking your support to really double down on the guidance, and that's largely because what we don't want is for us to experience a surge in cases that may impact on the operation of our local economy. So it's really brilliant what we've seen with the vaccination rate and its impact on reducing illness. But a surge in numbers can have a tremendous impact on workforce, both in your businesses, but also in public services. So it's really important that we try and adhere to the guidance for that little bit longer. We're nearly there, we're nearly at the end, and we just need to double down. So it's really important that any staff that you have that have symptoms, that you send them home from work to isolate, and that they seek a test. And that's really, really key. You know, the whole thing around isolation, and Jeff went through all the support that's available. That is the key intervention in breaking transmission. So it's really important that any sign of any symptoms, that you do make sure that those staff isolate. As Karina said, I think the guidance is a little bit stronger in terms of wanting us to adhere, both customers and staff. That's both in terms of use of the QR code, but also making sure that we have our staff following the guidance in full. Hygiene, spacing, masks, fresh air, all of that. What we found from previous outbreaks is that we have to remain vigilant, particularly beginning and end, how people travel into work, how they go home, if they get changed at all. It's those sort of times that people relax a little bit too much in terms of guidance, and it equally applies to any breaks that they take during the day. Again, they can forget that the virus, this current UK variant, sometimes known as the Kent variant, is very, very infectious. And we really haven't seen it in this area yet, because we've benefited from going into lockdown before it got a grip in our area. So extra vigilance there. Jeff went through the testing regime. We would encourage you to think about getting your staff as part of that bi-weekly testing regime, and whichever fits your size of business, go to the website and you can find whether to apply for the national scheme, as Jeff said, or use the Community Collect scheme instead. Obviously, if you've got staff eligible for vaccination, just to make sure when they get the call that you encourage them to get the jab. It's really important. Some of them may already have had vaccinations. It's really important they get their second dose as well. If they are part of the next cohort, really do want to encourage it. It is effective. It is very important that we vaccinate as many people as we possibly can. And if you have any doubts or concerns, or your staff have any doubts or concerns, don't let it fester. Do seek guidance and advice. You could come to us or go to the website and you will find the guidance that you need. And as a final point, I think we're in a really good place in terms of numbers now. The transmission rates come really down, but there are predictions of a third wave, as it's called, a surge in numbers. So we really do need to put that off for as long as possible, and therefore we really ask for your continued vigilance and support in the way that you have been doing all through the last year. So just again, thank you very much for all your efforts. If you have any questions, there are no stupid questions. So if you've got any questions at all, please do ask them now and we'll try and answer them. If not, just pop us a line. We're quite happy to answer them if they occur to you after the webinar. Thanks, Royce.
Thanks, Steve, and thank you to the speakers that we've had on today. Just to echo what Steve said, really, the information on the slides and a link to this recording on YouTube will be sent out. I'll aim to get that out close of play today. So do keep an eye on those emails. It will go to the email that you signed up to the Eventbrite link with. So do keep an eye on those. So I can't see any hands up. I can't see any questions in the chat. So hopefully you found this useful and we've answered all of your questions during the course of this. But as Steve and Jeff both said, just get in touch if you've got any questions and queries. I know I didn't introduce myself at the start. My name is Royce Coates. I work in the Council's communications team. My team's been doing a lot of work around getting the material to businesses so that they can let customers know what is expected and what the limits are of their premises and such like. If you are in a position where you haven't had that contact and you need some information, some publicity, some sort of promotional, posters, leaflets, anything like that, signage, floor vinyls, we've got that material. If you need it, let us know. So what I'll do is, just to make it a bit easier, I'll pop I'll tell you what, I'm going to email this link out anyway. So just reply to the link when you get it later on today and put in a request and I can sort out some materials for you. I'll put you in touch with the person who can. So yeah, just let us know. Okay, I think that's just about us done. I think we're finishing 16 minutes earlier than I predicted, so that's always good. So yeah, thank you, and yeah, that's it. So thanks very much. I'll let everyone go now.
Thanks, everyone.